Good morning, guys. I hope we're all sparkly. It's admin day today, hence the civvies. But I thought I'd pop out and do a quick video and talk about the new patient that I saw yesterday. He was a transfer of care from another clinic. He'd been on TRT for 5 years prior to attending the men's health clinic. We get lots of patients transfer their care over to us because obviously they like the idea of microdosing TRT, using the minimum effective dose to achieve the desired outcome. Stable male androgen levels for optimal physical and psychological well-being. They also receive the proper level of support and care that they need to allow them to go and do what? Earn their reward. So he'd been with this clinic for 5 years. He's now 60. So he wanted more, and good on him, because we should always be aspiring to achieve more. There is no reward. Effort is the reward. Understand that. So yeah, he was on a weird and wonderful TRT regime, which we'll talk about in a minute. But he approached the clinic and I asked for bloods. So he's on TRT. So we won't go over all of them. We'll go over the nitty gritty, which is obviously the hormone profile. He's on TRT. So you would normally expect pituitary suppression, no LH, no FSH, because exogenous testosterone suppresses the release of gonadotrophin releasing hormone from the hypothalamus to the pituitary, and the release of LH and FSH down to the testicles from the pituitary. So his LH and FSH. LH 5.3, FSH 8.1. Even testosterone suppresses the pituitary. So number one, you already know this is an ineffective treatment, and he was compliant with the medication and instructions. So this is bad, real bad. So what was his 17 beta estradiol? Now we know estradiol is protective to the brain, it's neuroprotective, it's cardioprotective, it has lots of benefits. We want a nice healthy testosterone to estradiol ratio, and this guy's estradiol level was less than 18.4. Yikes. Normal pituitary function on TRT and an estradiol of less than 18.4. Tanked his estradiol. Normal sex hormone binding globulin. We like sex hormone binding globulin, you know that. Normal prolactin. And obviously we get to the testosterone. So testosterone 16.7. Now the British Society for Sexual Medicine guidelines say you want to aim for between 15 and 30. That's nonsensical, because we really want to be looking at free testosterone. They don't give you any parameters for that, but we want a free testosterone of 0.5 to 0.85 typically. Again, some people feel better below, some people feel better above, but those people that feel better above don't feel better for long, because we're normalizing, not super physiologicalizing. So this guy clearly had suboptimal levels and a crashed estradiol. So what was his protocol? Well, I will let you know. He was on 10 milligrams of progesterone and 175 milligrams of testosterone lozenges daily. He was on 30 milligrams of pregnenolone. Okay, why? Now we know that cholesterol converts into pregnenolone, and it's the father hormone, and that cascades down to cortisol, aldosterone and testosterone, but there literally is no logic in that. And obviously the kicker is that he was on 1 milligram of anastrozole twice weekly. Ay, ay, ay. Hence his estradiol was in its boots. Now this is utterly scandalous and utterly irresponsible, because he wasn't being followed up either. So he was just left to his own devices with this bizarre protocol. He had perceived normal testosterone levels because he didn't have pituitary suppression, so he wasn't actually on testosterone replacement therapy. And he had crashed estradiol as a result of being overprescribed an aromatase inhibitor. So this clinic literally caused harm. So there's no doubt no wonder he didn't feel good. So it's about what? It's about showing due diligence, proper care and attention to act in the best interests of the patient. So there's a reason why we bang on about optimizing levels, microdosing TRT, using the minimum effective dose, but safely and effectively. Because that guy was actually being caused harm. And as one thing as a doctor, you should not be causing harm. You should be looking at providing the best level of care and service and acting in the best interests of the patient. This is utterly shocking. We get so many patients transfer their care over to the men's health clinic because they do their due diligence and research and they go, right, okay, well, I'm not happy with this. Let's go somewhere else. But when you've got low testosterone and you're desperate, yeah, you're reaching out for whatever you can take. And unfortunately, lots of companies do put lots of work into marketing. Sell. Testosterone will give you a good mood, a high libido, muscles. You will be superhuman. No, you'll be normal, because that's all we can aspire to achieve, because normality is amazing. Normality throws up challenges and you see them as opportunities. And ultimately, it's all down to you. Having an understanding of physiology, you go, right, okay, I don't want to be high. And we all want to be high, don't we? Because it's still our lizard alpha male brain going, I want to be high normal, but I don't. I want to be balanced. I want that ability to be objective, to be considered in situations. I woke up super grumpy this morning because I had a lot going on, both physically, psychologically, personal, work life. More. Take. And as I said in a previous video, I know I'm struggling when I feel as if everybody's taking from me and I'm not receiving, because it's all perspective, so it's also nonsense. And our job as a man is to lead by example. And it's to serve, really, isn't it? To make sure everybody else is okay. So I woke up grumpy, but I had my ice bath and I rebooted my system and I felt amazing. But was it all over? No. Came into work, somebody was a bit grumpy, and I thought, I want to react. But I'm not going to react because my testosterone levels are optimal, and I'm going to be considered and I'm going to be sensible, because if I react, it's going to escalate things. And the purpose is what? To restore harmony and balance within yourself, and as we are all mirrors, to the outer population and your consciousness. As we've said before, consciousness is the subjective appreciation of subtle changes in physiology. We really do need to understand that, because as I've said, I've struggled recently, so I checked my hormones and they're perfect. So it's nothing to do with my TRT protocol, it's to do with me. So I have to take a step back and say, right, what do I want and how am I going to achieve it? Effort equals reward. It's utterly fascinating, isn't it? So we often talk about that kind of excitatory part of your nervous system that's constantly firing to keep you alive, with your acute excitatory neurotransmitters firing, and you get the balance of the excitatory hormone that has a more of a chronic effect. And then you get the counterbalance of what? Yeah, your calming testosterone and your parasympathetic nervous system that you have to work on a day-to-day basis to make sure that your reaction to any situation is considered, because we have to be considered to do what? Earn our reward. Understanding the reward is an illusion, and the effort and the hardship is the reward.